to be in the very same room where at this time last year, His Excellency the President of the Republic launched his presidential initiative on HIV. I consider that a reminder that we've made progress, but we still have more work to do, and that we're in this journey together. I understand that the morning sessions have been very, very rich and informative, and it is my hope that we will share what we have learned with others and take personal responsibility for empowering those in our circles to know how to prevent HIV going forward. Ladies and gentlemen, we all agree that we need to strongly employ our efforts to accelerate HIV prevention activities. The statistics are somber. Honorable Chief Guest, every week, 950 Ugandans acquire HIV. I repeat, every week, 950 Ugandans acquire HIV. This means that in 2017, we were talking about 50,000 Ugandans. And unfortunately, most of them are young girls. I want us to pause and think, what are the implications of these numbers for Uganda that wants to become a middle-income country? What kind of citizens is the country going to have if we don't stop these numbers? These are our doctors and our engineers. These are our members of parliament and our ministers. These are our entrepreneurs and our teachers that right now, at such a young age, are already being infected with HIV. Uganda is home to an estimated 1.3 million people living with HIV, but unfortunately, almost a quarter of them don't even know it. About 74% of adults between 15 and 64 know their status, but this means that 26% of a very large number do not. In this context, 60% of Ugandans living with HIV are virally suppressed, meaning that the remaining 40% can infect others. We must commit as a country to meet the targets of this roadmap being launched today. We must reduce new infections by 75%. Instead of having 50,000 a year, we must have less than 15,000 new infections every year by the year 2020. Ladies and gentlemen, Uganda's National HIV Prevention Roadmap feeds directly into the Universal Agenda 2030. This agenda embraces sustainable and inclusive development. It's linked to Uganda's Vision 2040, as well as the aspirations of the African Union Agenda 2063. This roadmap specifically links to Sustainable Development Goal 3 on good health and well-being, and in particular, to Target 3.3, vying to end the epidemic of AIDS, and the indicator on the number of new HIV infections per 1,000 uninfected populations. But ladies and gentlemen, as we repeatedly said, allow me to reiterate, all the SDGs work together. People do not just need health. They need health, education, they need rights, they need food, they need decent work, they need clean water and safety and stability. In other words, they need partnerships for results to improve the quality of their lives without destroying the only planet we call home. What this also means is that we have a shared and a personal responsibility to act now. And this responsibility must be accompanied by increased ownership of the actions across the whole of Uganda's society. Not just government, but civil society, cultural institutions, religious institutions, and the private sector all have a role to play. In the spirit of leaving no one behind, allow me to commend the organizers of this symposium for having created space for the voices of young people. HIV prevention requires that we move hand in hand with the young people, cognizant of the increased new infection rates, recognizing the usefulness of Uganda's population, and also our shared need to end AIDS. Ladies and gentlemen, honorable chief guests, I believe that ending HIV/AIDS requires all of us to be part of the solution together. Ladies and gentlemen, we're a few days away, or should I say a week, from December 1st. Every year on the 1st of December, we commemorate World AIDS Day, which was first observed in 1988. So let's pause for a moment. That means that this year it's been 30 years of celebrating World AIDS Day. The theme this year, Live Life Positively, Know Your Status, is very important and timely. Honorable Chief Guest, I am distressed to note that 45% of Uganda's youth do not have comprehensive knowledge of HIV/AIDS. Without knowledge, how can we take action to protect ourselves and our communities? So allow me to use this opportunity to highlight some of the advantages of having the knowledge of one's HIV status. First, we can stay HIV-free. An HIV test result opens the door to accessing the range of HIV prevention options available depending on your status to keep yourselves and your loved ones HIV negative. Second, testing can save lives. People can only start HIV treatment if they know they're living with the virus. And nearly 200,000 Ugandans do not know they're living with HIV. Third, it is better to know early. The earlier that someone is diagnosed as living with HIV, the earlier life-saving treatment can begin. And the earlier the treatment is started after infection, the better the outcome. People can live long, healthy lives with early detection of HIV and proper treatment and care. Fourth, we can protect others. Testing is the gateway to treatment. An effective treatment is a great HIV prevention tool. It saves lives and prevents onward transmission. HIV treatment also reduces the viral load, the amount of HIV in a person's body, to undetectable levels. With an undetectable level of HIV, a person can pass on the virus to someone else. Fifth, we can stop HIV transmission in babies. A pregnant or breastfeeding woman living with HIV can access a range of options that can ensure that she remains healthy and her baby is born HIV-free and stays HIV-free. But this can only happen if she knows her status. Six, it enables you to claim your right to health. This is a decision that you can make, and this is a decision that you owe to yourself and to your loved ones. Seventh and last, taking an HIV test can also provide an opportunity to screen and test for other illnesses, such as tuberculosis, hepatitis, high blood pressure, and diabetes, thus saving money and saving lives. Ladies and gentlemen, before I conclude, a few words on stigma and discrimination. Honorable Chief Guest, has been brought to our attention that there are many reasons why people fear getting tested. Stigma and discrimination, fear that your loved ones will shun you, lack of confidentiality, as there are still cases where results can be disclosed to others without their permission, fear of repercussions among the community, lack of appropriate and affordable health services, resources, and supplies. This is why WHO and UNAIDS advocate for the observance and adherence to the 5 C's of HIV testing. First C, consent. People living with HIV testing must give informed consent to access testing and counseling. 2, confidentiality. HIV testing must be confidential, meaning that the HIV testing provider and the client discussed should not be disclosed to anyone else without the express consent of the person being tested. Counseling. Pre-test information should be provided, and people should have the opportunity to ask questions in a private setting. Correct results. Providers of HIV testing must provide high-quality testing services, and quality assurance mechanisms should ensure that people get the correct diagnosis. And the last C, connection, linking HIV prevention to treatment and care, as well as appropriate follow-up, including long-term prevention and treatment support. Ladies and gentlemen, honorable guests, as I close, we must commit as a country to meet the targets of the roadmap, to reduce new infections by 75%, which means having less than 15,000 new infections by 2020. We can do this if we commit to getting tested, to know our status, and ensuring that those who are negative remain negative. We can also ensure that those who are positive get virally suppressed. We can do this if we follow the actions outlined in this roadmap. We at the United Nations will remain focused on HIV until it is gone. Through our joint UN program on support of AIDS known as JUPSA, we will continue to mobilize Ugandans so that we can end AIDS in our lifetime. We support the Presidential Fast Track Initiative to end AIDS in Uganda by 2030, and we will remain your active partners in this fight. We are also pleased to have partnered with the government of Uganda and supported this national HIV prevention symposium, which I do hope is not the last one, but the first of many. Ladies and gentlemen, I am proud to witness the launch of the Prevention Roadmap,